Okay, so chapter 1 is just an introduction to the pathophysiology, and health is just everything normal, physical, mental, and social. Disease is deviation from normal, of homeostasis. Actually, the definition is something that you need to know. Deviation from normal status of homeostasis. What's homeostasis means? Normal state? Yes. Homeostasis basically means keeping stable environment. This is what they need you to know. Keeping stable, normal environment. Okay? So any deviation from that is considered disease or pathology. And this is something that we will be talking about. Deviation from normal. pH is 7.35 to 7.45. It's 7.5. Disease. Abnormal. Any deviation, your temperature is supposed to be 87.6, for example, or 98.6. If it is 99, it's abnormal, and so on. So anything that's shifting from normal is abnormal. It's a disease. There are a lot of indicators for the normal, but it's different by age, gender, genetics, environment, and activity levels, meaning that what's normal for you, but not necessarily normal for me. Like if your heart rate, for example, is 70 per minute, and that's normal. How about a child? He will be 90, and this is normal for his age. How about a newborn? 110. Oh, that's tachycardia. It's not tachycardia. It's normal for the age. Okay? So that's what it is. Gender. Males tend to have higher numbers in blood than females. You will see that all the time. So my blood count is 6 millions and you are 5 millions. Is that abnormal? No. It's normal for your gender and so on. So it's different from age, gender, and so on. 7 steps of health. You actually need to know that, and you can see a question about this. And it's all common sense, basically. What should you do? Non-smoker, not even second-hand. Of course, it makes sense. Eat vegetables and fibers. Physical activity on daily basis, on regular basis. Protection from sun. Cancer screening guidelines. Something like cervical examination at certain age, breast examination at certain age, colonoscopy at certain age, and so on. These are all indicators or screening methods for cancer that should be done before the actual fact. You visit the doctor on a regular basis. They will do the regular checkup. If there is something abnormal, they will tell you. Follow the regular guidelines for disposing things and so on. Pathophysiology, just think about it, it's very basic. Pathophysiology, what physiology means? Studying of normal function. Yes, it's studying of normal function. Okay? Studying of the function under normal circumstances. A change to that is pathophysiology. Okay, so patho is changing or abnormal or changes that happen to the normal function or anatomy. So AP1, AP2, normal physiology, normal anatomy, right? If you shift from that, from the normal, this is called pathophysiology. So just understand the word itself, pathophysiology. Pathology to the physiology. Change to the physiology. Shifting away from the normal function and structure, normal structure and function. Okay? Prevention is something that's very important to do, which is instead of waiting for something to happen, you can have the measurements to prevent the disease, like vaccination. Vaccination on a routine basis. There is a chart that's usually given to the newborn, to the mom. At 3 months, you have to give the baby this. 6 months, 1, 10, 50, and so on. So this, by following the vaccination programs, this decreased the incidence of the disease a lot. Prevention is always better than treatment. Participation in screening programs. There is a screening for, they announced that. There is screening for heart disease. Just go and you will fill up a form. What's your age? Are you smoking or not? What's your weight? And so on. They will tell you if there is a chance for you to have a problem, a heart problem or not. Community health programs, routine visits. You go to the doctor, they check everything. Oh, your blood pressure is not normal. Let's see what's happening, and so on. So this is more for prevention rather than treatment. The medical history is something that most of us, if not all of us, are familiar with. Remember when you go to the doctor, what happened? What they ask you the first time? History. Did you have a problem before? Is your heart is okay? Did you do surgeries, right? Don't they ask all these questions? So it's all common sense. They ask you about everything, right? We all went to the doctors, right? For routine examination. And he asks you just regular questions. This is your first time. Did you have a problem before? Did you have any disease? Is your heart okay? Did you have a problem with your heart before, which is called the past history? Did you have any surgeries? They ask you this routinely, right? The nurse asks you about that too when you go. Even when you write down the paperwork, it's covered the exact same thing, right? Did you do surgeries before? Are you taking any medication for anything? Isn't that routine? So it's all common sense. And for the medication, they ask you, are you taking any medication, whether it's prescription or not. Sometimes you're not taking prescription, I'm taking vitamins. Just let them know, right? Are you taking any herbs? Sometimes people take herbal treatments, that's good, and sometimes you take randomly. I got this from China, I got this from that, and you have to let them know. So it's about everything. Were you hospitalized before? Are you having a problem with anything? Urinary dysfunction, are you having a problem going to the bathroom? Sexual difficulties, are you having problem walking, and so on. So they basically ask about everything for the medical history. Anything that's adding up to the new research and diagnostics, this is all updated on a regular basis, which is not when I skip something like that, it's not the most important, okay? I'm focusing more on the more important things, okay? In pathophysiology, we will be talking about gross level. Do you remember that in the very beginning? If you did AP1, this was the very, very beginning, right? You start from the molecular level, and you go to the organelles, and you go to the cell, you put cells together to make tissues, you take tissues together to make organ system, and the whole body. So it goes like this: gross level, microscopic level, the cells, and there is biopsy and autopsy. What's the difference between those? Biopsy and autopsy. Biopsy is if you're still alive, autopsy is after death, okay? So in both cases, you're taking something to examine it. So let's say you're having heartburn, for example, and it's been consistent, you're taking treatment and it's not changing much. So let's do an endoscopy and take a biopsy. They will examine and see if there is anything abnormal, but you're alive. If there is something happen and they're expecting something after death, they do autopsy. So biopsy and autopsy. Diagnosis. When you diagnose something, you identify a disease, meaning I'm having pain here, okay? I ask you some questions. Did you have a problem before? Do you have a problem walking? Do you have a problem going upstairs or running or something like that? I start to do like ECG, something like that, until I reach to the diagnosis, which is a specific disease. I'll tell you, this is angina, for example. So this is diagnosis. The cause or the causative factor is completely different than the predisposing factor, and you need to understand that. Predisposing factor is different than precipitating factor. This is something important in pathophysiology to understand, and they ask about it a lot. Causative factor, predisposing factor, pathogenesis. This is important to know. Basics, okay? So the causative factor, the cause, or they call it the etiology. You need to be familiar with this word, etiology. Etiology means the cause. Etiology or causative factor is different than predisposing factors. Predisposing factors it's not the actual cause of the disease. You have a heart attack because you're obese? No, that's not true. You didn't have heart attack because you're obese. You have heart attack because changes happened in your heart and part of your muscles dead. This is the cause, okay? The blood supply shuts off. This is the cause. This is the etiology. It's not the predisposing factor. Predisposing factor is something that might lead, increase the chances of something to happen. Did you get the difference? Shut off the blood supply is cause, it's etiology. Obesity is not etiology. Both of them can lead to heart attack, yes. But what's the cause and what is the predisposing factor? So in this example, obesity, smoking, this is a predisposing factor. Sometimes you're obese, you live your entire life, you don't have heart attack, right? So can you say that obesity is a cause? It's not. It's just a predisposing factor. So it's basically increase the chances of, increase the tendency of. The causative or the etiology is the actual reason. Why did you have heart attack? Because the blood supply shuts off. Something blocked the blood supply. This is the cause. Did we get this point? Pathogenesis, basically, patho means disease. Genesis, generation, to generate. Always, when you see a word like this, don't take it as it is. Cut it into pieces, you will understand what does it mean. And this is, most of the time, is true. So don't take pathogenesis as a development of the disease. No, it's pathogenesis, because you will see genesis alone and you will see patho alone. Patho is disease. Genesis is generation. So pathogenesis is how the disease was generated. Okay? Heart attack. Tell me the pathogenesis of your heart attack. You'll say, okay, and this patient had lipids increased and the lipids deposited in the wall of the blood vessels, the lumen become narrower, and then a blood clot came blocking it, and then the muscles started to have deficiency of oxygen, lead to death. This is called pathogenesis. Did you get the idea? The process of generation of the disease. How the disease was generated. What are the steps that lead to that? Acute disease versus chronic disease. Acute is something that happened all of a sudden, short term, okay? Something like pneumonia. Have pneumonia. Stayed for 10 days, 2 weeks, and then went away. Short time, definite time. Symptoms are very obvious. Fever, cough, bony aches, muscle aches, something that's very obvious. Symptoms are very clear, short term, all of a sudden. Chronic is something that's mild and take for longer time. Sometimes you don't even feel it, okay? Like some people have chronic hepatitis, for example, and they don't even know. Why? Because you're not seeing something acute, right? Why would somebody think that he's having chronic hepatitis? Because he's fatigued all the time. Anybody can be fatigued, right? Because there's a little bit of yellowish discoloration, just a little bit. Did you even notice it? I didn't notice it, right? The urine is a little bit dark. Doesn't mean anything, right? So this is chronic, something that's happening for a long time. You have chronic hepatitis for 3-4 years. It's mild. It's not something that's obvious, that you notice easily. But acute is like acute hepatitis. All of a sudden, I notice something that's horrible. My eyes are actually yellow. Okay, I can't move. The urine is brown, red, right? So it's something that's happened in short period of time, And the symptoms and signs are very obvious. And by the way, they call the symptoms and signs together manifestations. Manifestation, this is something that you need to know. Manifestations. Manifestations are signs and symptoms. What's the difference between signs and symptoms? Does anybody know what's the difference between signs and symptoms?
Signs are like
Is what? You can say whatever you want.
kind of like present that you can see, like
Yes.
fever,
Yes.
coughing or something.
And symptoms is how you feel.
Yeah.
Like
Exactly,
what's
yes.
going on internally.
Yes. The symptoms is what you complain about. Why are you here today? I have pain, I have fever, so you're complaining, you're saying something, right? This is for the symptoms. Signs is something that the doctor or the nurse see. Okay, let me see. Yeah, your blood pressure is high, you have a fever. Your color is a little bit dark in this part. So this is something that you see. The patient didn't complain about it. So what the patient say or complain about, this is called symptoms. What the healthcare professionals see, notice, these are the signs. Signs plus symptoms, this is called manifestations. Okay? So basically, short period of time and acute manifestations. This is acute, mild, long time, and less acute of manifestations. This is chronic. Latent state, this is where no symptoms and no symptoms and signs. There is no manifestations. So manifestations, a lot, fever, darkness, something that's very obvious. Short period of time, that's acute. Mild manifestations, long time, this is chronic. No manifestations, no manifestations. But there is something going on. You didn't complain about it, and nobody see anything. This is called the latent stage, okay? Something like cancer is going on inside. Did you complain about it? No. Did anybody notice anything? No. No signs, no symptoms, so no manifestations, right? Nothing. And then later on they found there is a problem there. So this is called latent, which is the stage before manifestations. Did we get this point? Good. Incubation period, this is specifically for the microorganisms, okay? Like you have flu right now, okay? You have flu. You're coughing, you're sneezing, you have bony aches and so on, okay? Were you exposed to somebody who is sick, having flu? No, oh yeah, like 2 days ago, I was in the classroom and a lot of students were having flu. Yes, you got the flu this day. The virus entered your body, but you didn't notice anything because this is a latent period, which is from the organism entered to your body. You didn't feel anything yet. Invade, you didn't feel it. Go to your cells, you didn't feel it. And then the cells started to be destroyed, now you feel it. So from the entrance until you see something, this is called latent. Prodroma is different. Prodroma, these are the early manifestations. And some of us actually, does anybody have chronic migraine? You get migraines a lot? If you have migraines, do you notice that there is something, you can tell, I'm going to have migraine in an hour. Did you ever notice that? How did you know? I have this flashing of light, I have some tingling, and I think I'm going to have a migraine in an hour. An hour later, you have the migraine. What was that? Prodroma. Prodroma. This is an early sign, which is obviously different than the incubation period. This is completely different, right? So pro means before. Prodroma means before you get the full-blown event. As I mentioned before, flashes of light. I have tingling in this side. I know I'm going to get a migraine, right? So this is called the prodroma. Prodroma. Early development. It's not very specific. I mean, you tell me I have flashes of light. Does that mean anything? But you know that this is going to develop into something. This is called prodroma. Manifestations are symptoms and signs combined. Okay? These are the basics. You have to know this. You will be asked about it. You have to know. Manifestations are signs and symptoms. What are the signs and what are the symptoms? We discussed that. How about syndrome? Syndrome is a disease? No. Syndrome is not equal to disease. It's related, but not equal. Syndrome is a group of signs and symptoms that affect more than one organ at the same time. And this is called syndrome, like Klinefelter syndrome. Okay? Klinefelter syndrome, what is that? This is something in genetics. This is genetic abnormality. So there is something wrong with the ovaries. That's it? No, there is something wrong with the uterus. That's it? No, there is something else happening in the heart. Okay? So this is called syndrome, not a disease. A disease is something like hepatitis, gastritis, colitis, gastric cancer. Something is specific in one organ. But if you have a group of manifestations, okay, she cannot get pregnant, and at the same time, she's not having the period. At the same time, if she walks up the stairs, she starts to have problems, and she's coughing. So there's something wrong with the lung and the heart and the ovaries, all combined. Syndrome, not a disease. Did we get the difference? It's not the same. Remissions and exacerbations. Language of pathophysiology is all important. I'm sure you will see this. Okay? They have to make sure that you understand each one of those. Remissions and exacerbations. What does it mean? Remission means disease is going down. It's not disappearing. The acuity of the disease or the manifestations decrease. And when it increases, they call it exacerbation. So it goes like this. I'm having a problem. I'm having, let's say, pneumonia, okay? Fever goes up. I'm coughing a lot. I'm having a problem. And then, do you still have fever? Yes, but it's going down and a little bit. I think I'm going to be fine. No, the fever goes up again, okay? And the next day it goes down. This is called remission and exacerbation, okay? Remission, exacerbation, remission, exacerbation. When you remit, means you become good. You become better, actually, not good, sorry. You become better. You improve a little bit, and then it goes up again, goes down. So a lot of diseases, especially chronic diseases, will go up and down, up and down. Are you cured? Are you fine? No, you're not. You're not cured. You still have the disease, it just goes up and down. Precipitating factors is what triggered the acute episodes. Something like this. You're having chronic hepatitis, okay, for a couple of years. And right now, you have shooting of everything. Yellow, discoloration, fatigue, urine is very dark, pain, you have a lot of things, which is acute hepatitis. What triggered the acute hepatitis? You are exposed to another dose of the virus, for example. Or you made a lot of effort in something. You exhausted yourself a lot. So that gets you to acute episodes. This is called the precipitating factors. Something that triggered the acute episode. Do not confuse precipitating from predisposing from causative factor, 3 factors. Do not confuse those together. Are we following so far? Is there anything hard? Okay, so causative is different than precipitating, different than predisposing. Specifically, predisposing is completely different. Predisposing doesn't do anything. It's not the direct cause. Obesity, this is not the cause. It's just a predisposing factors. Complications, these are new secondary or additional problems. Something like this. Complications. Let's say this person is having a stroke. Okay? This person is having a stroke. What is the predisposing factor for the stroke? Hyperlipidemia. He's eating a lot of fat. Okay? He's old. Sedentary life. This is all obese. This is all what? What do you call all of what I mentioned so far? Predisposing. Right. That's all predisposing, right? And then a blood clot formed, blocked the blood supply to the brain tissues, part of it died. So what is the causative or the precipitating factor? What caused the actual disease? It's a blood clot. Not the obesity, not the sedentary life, not the hyperlipidemia. Are we following so far? It's the blood clot. This is the cause. This is the etiology. What's the pathogenesis? The oxygen didn't go to the tissues. They lack oxygen. The tissues start to have higher demand, start to die, death. This is the pathogenesis. Are we following so far? Okay, so now this person have a stroke. Okay? And after the stroke, right after the stroke, he cannot move much. Okay? A week later, now I cannot move my right arm. I can move my left only, not this. What is this? This is a complication. Okay? Something that will happen later. Beside what happened already during the episode, something that happened next week, next month, next year. Okay? Complication. Something that happened later on. This person is having chronic bronchitis. Okay? Chronic bronchitis. Coughing all the time, have inflammation, infection, and so on. 5 years later, he started to have COPD, chronic obstructive lung disease. Chronic obstructive lung disease. This is a complication, something that happened later on top of, secondary to. Okay? Therapy is obviously the treatment for the disease. Sequelae is the unwanted outcomes. Something happened right after, not a complication. It's not the same. Sequelae is not the same as complication. Some complication is something that happened later on. Sequelae is something that happened right after the disease. Convalescence is the period of recovery. Basically, convalescence is like this. I have flu right now. I had it for 3-4 days, but now I feel a lot better. Okay, I'm about to cure. This is called convalescence, and you're still infective. You can infect people, right? Did you get the idea? You're still infective. You can give me, but I'm not coughing. I don't feel the high fever. Yes, because you're about to cure, which is called the convalescence. So the convalescence is the last few days before you actually get the 100% cure. Just a little bit before that, this is called the convalescence. Prognosis is what is the expected outcomes, basically. Like somebody's having a cancer. Okay, a doctor, can you tell me what are the prognosis? Well, unfortunately, you are in stage 4, so that's too late. The prognosis is very poor. Okay, the life expectancy is 6 months, for example. Okay, what's the prognosis of my heart attack? The prognosis is not good. Most likely, half of your heart is gone, for example. Kidney, same thing. So prognosis is expecting what's going to happen. It's not necessarily 100% of the time true, but most of the time it is because expecting. What's my prognosis, doctor? Can you tell me what's most likely is going to happen? This is prognosis. Rehabilitation is getting the best out of the organ, basically, in simple words. Yes?
So the convalescence is the same time as remission, correct?
No, the difference is remission can go to another exacerbation. Remission, exacerbation. But the sequelae is, after all of this, you're curing now. You're fine. But you have a problem because of this. That's happening immediately after the disease. So the difference is remission can be followed by exacerbation. But sequelance or the sequelae is the disease is over and now you're stuck with something. Disease is over and you have this problem. Okay? Rehabilitation is to maximize the function, meaning you already have stroke, you already have paralysis, but can we at least improve it a little bit? Go to the physiotherapist, and he will make your muscles a little bit stronger. So actually some people have paralysis, but they can walk, right? They can. At the beginning, they can't completely, but you can improve. So getting the best. I have COPD, my right lung is really bad. We can improve it. Can give you some treatment for the lung, so you can breathe a little bit better. So getting the best out of the diseased organ, basically.
So is that similar to therapy?
Rehabilitation? It is kind of therapy, but it's exactly like the physiotherapist, which is improving the function. The organ is bad, but instead of leaving it as it is, non-functional or bad, I'm going to improve. Are you going to cure it? No, this is different. It's not treatment. I'm just improving it. Instead of having complete paralysis, you cannot move at all, and you have to use something. No, I'm going to give you some exercises to improve it. So you're 40%, 30%. You can use it a little bit. This is rehabilitation, which is not the same as treatment. Treatment is something that you take and cure. This is not cure. Just improving a little bit. Yes?
So you go to rehab because of the sequelae? Because of the unwanted?
Yes, you can say that. If the sequelae lead to something that can be improved, it's called rehabilitation. That you improve the outcome or maximize the function of anything of the organ. Epidemiology is basically tracking the occurrence of the disease. So epidemiology, if there is an epidemiologist, some people have masters in epidemiology. What's the epidemiology? Epidemiology is you're tracking the causative factor and the occurrence. So here is your job. As epidemiologist, I want you to tell me about heart attack, okay? In Clinton Township. This is your job, okay? So here it is. Go around, go to the hospitals, find people that have heart attack, and ask them, did you have heart attack? Yes. What was the problem? How did you get into that? Were you overweight? Were you hyperlipidemic? What exactly happened? So you're tracking, and you have a pool of like 100 patients. Are we following? Get 100 patients and tell me, out of the 100, how many have it because of the obesity, how many have it because of hyperlipidemia, and so on. So I'm tracking this with that. And I have in Clinton Township, there is 10,000 residents. Out of the 10,000, how many have the heart disease? It's 100. So the occurrence is 1 per 1,000. Is that clear? So you're tracking the causative factor and the occurrence percentage. Tell me how many person in America having sleep apnea? 7%. Okay. Also tell me what caused the sleep apnea. You track it with the patients. Okay. Morbidity versus mortality. Morbidity is basically disease. Disease. How many person are diseased in Clinton Township? Mortality, death. How many deaths in Clinton Township in 2017? Okay, so morbidity versus mortality. Epidemics versus pandemics. This is obviously different. Epidemics is more than expected number of disease. Meaning, we have an epidemics of hepatitis in Oklahoma, for example. Epidemics. What does that mean? Does that mean that there are some people who are sick, have hepatitis in Oklahoma? No, it doesn't mean that. It means it used to be 1 per 1,000 of the population that have hepatitis. Now it's 5%. This is epidemic. Okay? So it's a lot or higher than expected number. You say there's an epidemic of hepatitis in this state. There are epidemics of flu in this state. So it's higher than expected. Does it mean that people have flu? No, people always have flu. This is not the problem. The problem is it's higher than expected. You say this is epidemic. But this has to be within a given area. Exact same thing. If it is happening in different countries, you call it pandemic. Did you get the difference between epidemic and pandemic? It's the same. But pan, all over, pan means all over. Translation, pans mean all over. So pandemic is the same as epidemic. So you say there is pandemic of hepatitis. Where? In America and Mexico and Brazil, for example. This is a pandemic. This is not an epidemic. So you say epidemic in Michigan, epidemic in Oklahoma, epidemic in America. But if it exceeded the country, going to several countries, you don't call it epidemic anymore. You call it pandemic. Did we get the difference? Occurrence of the disease is the actual incidence and prevalence. Incidence means the new cases. Incidence means new cases. Okay? Is it the same as occurrence? No, it's not. What does that mean? What's the difference? Occurrence means we have 500 person in Clinton Township having flu. Okay? Does that include people who had flu before and have it now? Yes. But incidence is only the new cases. How many have it now? Okay? Heart attack. Let's say this is a better example. Heart attack. How many person in Clinton Township have heart attack? All of them. All of them. This is the occurrence. 5,000. How many of them have it now? Or during this week? Or during this month? It's only 50. So 50 is the incidence, 500 the occurrence. Did we get the idea? So incidence is basically the new cases only. Prevalence is something like this. What is the prevalence of hepatitis in Michigan? Meaning the percentage of, okay? Or how many person are deceased. Communicable diseases, these are the diseases that can be transferred from person to person. Something like heart attack, of course, that's not communicable disease. I have heart attack and I'm dealing with you, so you get heart attack from me? Of course not, right? This is non-communicable disease. Flu is communicable disease, cold is, hepatitis is, and so on. Communicable disease. There are some diseases that are called denotable or reportable. These are the diseases that must be reported. But how about the privacy? This is not a violation of privacy. The doctors and nurses, they have to do it. If you see a case of TB, you have to let us know. Okay? You have to report. You don't tell everybody, you don't put it in the media, but you have to report. Okay? So there are certain diseases that, there is a list of diseases that you have to notify if you see it. Autopsy, we talked about this, which is the cause of death. Now atrophy versus hypertrophy versus hyperplasia, metaplasia, dysplasia, anaplasia, neoplasia. This is all very important, this part. I know I'm covering almost everything, but there are certain parts that are actually very important. So far, like the language part and this. 100% sure that you will see something like that. You have to know this. This is the basics upon which we will build everything else. Okay? So this is something that you have to know. Very important. Okay? And to understand that, we need to know first what plasia means and trophy means, from which we're going to extract the meaning of each one of those. Okay? Trophy means size. Plasia means number of cells. Trophy is size of the cells. Plasia is number of the cells. Did you get this? Write it down, remember it, and you will get everything from those. Okay? So, trophy, let's put an A before. What A means? A in Greek or Latin as a prefix. What does it mean? Without. Without. Hyper. What? Hypo. Less. How about plasia? Hyper and hypoplasia. What plasia mean again? Number of cells. What's hyperplasia? Increase number of cells. What's hypoplasia? Decrease the number of cells. Did you get how to know these? The easy way? Just understand the base. Where did it come from? Don't just memorize it. Atrophy is a decrease. No. Don't do it this way. Just know that atrophy means size. And you will get everything from that. Plasia means number of cells. So atrophy, decrease the size of cells. Like people have paralysis. If you feel their muscles, you will see if somebody's having paralysis here in the right side. Okay? The size of the muscle is shrinking, smaller. This is called atrophy. Versus hypertrophy, both of them are the size. The size. This person is athletic. He go to the gym all the time. He's carrying weight and so on, and his muscles are big. This is called hypertrophy. Okay, and hypertrophy not necessarily a bad thing or a good thing. Sometimes it's good, sometimes it's bad. Okay, so hypertrophy, just the exact meaning is increase size of the cells. Hypertrophy, high, trophy, size. That's it. We will discuss the details, but I'm just letting you know. It's not necessarily something good, not necessarily something bad. Sometimes the size increase because you're just athletic. You just doing exercising or something. Sometimes hypertrophy is something pathological. You have a problem that leads to increase the size of the cells. So this is details, but what we have to know here is hypertrophy. The next one is hyperplasia versus hyperplasia, versus hypoplasia. Hyperplasia, increased number of cells. Hyperplasia and hypertrophy, in both cases, most likely it will lead to the organ becoming bigger, but in two different ways. Does the organ become bigger because the cells become larger, or the number is increased? Did we get the idea? Did you understand this? So hypertrophy and hyperplasia, both of them can lead to the muscle become larger. Hypertrophy, the muscle is larger. Hyperplasia of the muscles become larger. The overall size, but with two different reasons. Are we following? So hypertrophy is, the number is the same. I have 5,000 muscle fibers, but the muscle is bigger. Yes, because the size is increasing. Or the size did not increase, but the number increased. So both of them can lead to bigger organ. So if you look at this is normal cell, and this is atrophy. Look at the size, compare the size of this to this. Compare it to this. This is 5 cells, this is 5 cells. This is normal, atrophy versus hypertrophy. Did you get this one? Atrophy versus hypertrophy. Hyperplasia, how many cells? 8, so it's increasing, right? Increased number. We will also have the metaplasia, dysplasia, and neoplasia. These are the other things that we need to know. And metaplasia is translation. What's plasia? Number. Meta means different, translation. Write down this, remember it, do whatever you want. Okay? But trust me, as we go, anytime I give you a prefix or suffix, it will be repeated. And I will remind you later on. Okay? So meta means different. Did you get the translation? So what's the metaplasia? Cells, increased number of cells, or different number of cells that are different. Cells that are different. And the example of that is metaplasia. Mature cells are replaced by different mature cells. And let me give you an example of that to make more sense. In anatomy and physiology, we know that the lining of the esophagus from inside, the epithelium, is different than that of the stomach. Do we know that? It's different. Okay? Here it's squamous epithelium, and here it's columnar epithelium. Do you guys remember this? Okay, so we have different. Why? Because the esophagus is prepared for physical resistance. Physical resistance. You eat food, and the food will have friction with the lining of the esophagus, and the lining of the esophagus should be strong enough for that reason. How about the stomach? It's a different type, which is columnar. Why? Because columnar epithelium are more chemical resistant. Chemical resistant. Why? Because of the acids, right? And this is normal. Everything is prepared to do the function. The esophagus is just a canal that takes the food from the mouth to the stomach, that's it, right? So it has to be physically strong, which is squamous epithelium. Squamous epithelium is a type of physically resistant epithelium, all right? Columnar epithelium is chemically resistant, meaning it can deal with the acid. If you ask yourself, do you know that if I take a sample from your stomach acid and put it on your hand, it will burn it? How come you have it inside in the stomach and you're fine and you don't have it in your skin? Because the skin is physically resistant, but not chemically resistant. So the stomach is chemically resistant. That's why we have acids up to pH of 1 and we're fine, okay? So here's what's happening. You have GERD, reflux or something. We have heartburn, right? Heartburn is happening all the time. Sometimes it comes occasionally and you take something and you're fine. But some people have it chronic, right? I have heartburn all the time, every day, for a year. What's the problem? Here's the problem. Acid go to the esophagus. The esophagus is not prepared for that. It's physically resistant, not chemically. So you're going to burn the squamous epithelium another time. Burning, 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 burning. By the time it takes like a couple of years, and then the esophagus will say, okay, obviously I'm going to be exposed to the acid all the time. So I need to change my squamous epithelium in this part to the columnar epithelium. You're not giving me the chance to heal, right? So I'm going to replace. So guess what? Now the esophagus is resistant to chemicals, that's good, but this is called metaplasia. And metaplasia is precancerous. And this is what they feel the most. If you have a heartburn or something that's chronic, and they give you some medications, something like ranitidine or omeprazole or something like that, and you take the treatment, no, I'm still bad. Okay, try this. I'm still bad. I'm still bad. For a couple of years, what they do? Endoscopy, right? Do you know that? They do endoscopy. Why? Because of this. Metaplasia. Take it as a rule. Anytime you replace type of cell with another type of cell, that's not even bad. Just you replace squamous with columnar. Both of them are okay. Both of them are normal cells. But this is not supposed to be here. This is precancerous because it's metaplasia. Did we get the metaplasia? Metaplasia of squamous epithelium of the esophagus. Dysplasia means cells that have different size and shape, which is not supposed to be the case. In the esophagus, you have to have a sheet of squamous epithelium, all of them same number, all of them same shape. If that's different, that's called dysplasia. This means difficult. The actual translation is difficult, but it can mean variant, difference. Okay? So dysplasia is different sizes and shape. You look at the cells, every cell is different and they have different shape. Anaplasia. Anaplasia. Plasia means number. Anaplasia, ana means undifferentiated. What's undifferentiated means? Here is what it means. Any cell, normal cell in your body is differentiated. What differentiated means? Means it's ready to do the job. This is differentiated hepatic cells, meaning a mature cell of the liver that's doing a normal function. So for the cells to do the normal function, it's differentiated. Differentiated means it takes its own shape, it's normal, it's doing the job. Okay? Mature, doing the job. Now, how about this? Neoplasm is a generation of new cells, okay? In a faster rate. We know that, right? To the extent of generating cells that's not even differentiated yet. It's prematurely. Like the bone marrow is supposed to make 5,000 cells per day. And this person is having leukemia, cancer of the bone marrow. So instead of doing 5,000 per day, it's not 10,000, you need to do 100,000. So it's very premature. Give me more. The bone marrow doesn't have the time to have the cells well prepared, well mature, differentiated. Okay, did we get the idea? If you're making bread, for example, okay, and you can do up to 50 per day, okay? Get everything, give it the time, you have the time, you're relaxed, everything is okay. Put it, it's well, looks good, everything is fine. So you can do 50. Can you give me 100? That's a lot. No, you have to do it. Okay, it's not going to be perfect. Give me 5,000. No, I can't. No, you have to give it to me. Okay, here it is. Right? Do you have the time for everything to be well cooked and everything is good? Of course not. So here it is. Take it prematurely. I'll give you whatever I have. Right? So it's undifferentiated. Did you get this idea? So normally the cells should have the time to be differentiated. If you're pushing it too much, it will be undifferentiated, which is anaplasia. That's a stage of cancer. Okay, a stage of cancer that will lead to cancer, anaplasia. So both anaplasia and metaplasia will lead to, and dysplasia, actually all of them are abnormalities that can lead to neo. And neo, N-E-O, is a prefix that means new. It's just a Latin. Instead of the W, you have the O. So neo is new, it's the same thing. Neoplasia, a new number of cells. New is bad. It doesn't mean good. So neoplasia is basically means tumor. Are we following so far? So when you see something, do yourself a favor and cut it into pieces to get what it means, and instead of just memorizing. Yes?
You said anaplasia was the first stage of cancer?
Not necessarily the first. It's one of the stages of cancer. It can be before that, it can be other stages, after that, other stages. So it's one of the stages. So here is the point of differentiated. Remember this. Normal cells are differentiated. Normal cells doing normal function are differentiated. If you are creating cells in a faster pace, you don't have the time to differentiate. It's undifferentiated. This can lead to cancer. Anaplasia. Anaplasia. Okay, these are also important things to know. Apoptosis, programmed cell death. Is that something good or bad?
Normal, not necessarily bad.
Good, bad. Apoptosis is something that's very good. Apoptosis is a programmed cell death. What does it mean? The cells know itself. If this is the end of the life and the cells are not doing anything, it should die. If it didn't die, it can lead to cancer. That's how good it is. Okay? Meaning your skin cells are going to die anyway. You know that? You know that you replace your skin cells every day? Stomach cells will be replaced every day. Where does it go to? Apoptosis. It will kill itself. It's programmed cell death. It's programmed in the nucleus. The nucleus know. We've been here for 24 hours, that's it. Death. Okay? This is actually protective. And guess what? One of the reasons of the cancer is lack of apoptosis. So let's say, what's the lifespan of the red blood cells? 120? Yes. What if what happened after the 120? Apoptosis. What if the cells live for 3 months or 4 months? That's bad. That's not something that's helpful. Because after the 120 days, it's useless. You give it more time, it can become cancer. So apoptosis is a protective mechanism. Ischemia and hypoxia are related to each other. What's ischemia? Translation. Esk means less. Translation. Esk. Emia means blood. This is just a translation, by the way. I'm not explaining anything. Just a translation. Esk means low, less. Emia means blood. Are you going to see this a lot? Yes. You will see hyperemia and so on. You will see emia all the time. So if you know that emia means blood, you got it. What's ischemia? Low blood, carrying low oxygen. What's the function of the blood? The main function. Carrying oxygen and taking away carbon dioxide, right? This is the main function, not the only, the main. So less blood, less oxygen to the cells. Ischemia. Less blood. If less blood go to the organ will be strained, will have a problem, not getting enough oxygen, which is bad. But the cells didn't die yet. It's not death. If the cells died from ischemia, you call it infarction. Get this. You will see it. Hypoxia. What's hypo? Low. What's oxia? The name gave it away, right? Hypoxia. Low oxygen. Ischemia. Less blood. Carrying less oxygen. The cells get less oxygen. So what? So that will lead to infarction. And we will see it later, but understand it from now. Infarction. What's infarction? Death because of shutting off the blood supply. That's it. Death because, is it death? No. There are different ways of death. Death specifically due to shut off the blood supply. You cut the blood supply, like stroke. What's a stroke? Stroke is infarction of the brain due to shutting down the blood supply to the brain. Does it mean death? No. There are different ways of death. I'm talking about one way. Did we get the idea so far? Okay, physical damage versus mechanical damage versus chemical damage. Any one of those can lead to death. Physical damage, you're exposed to heat or cold or radiation. Can heat cause physical damage? Of course. How about burn? Doesn't burn lead to death of the skin cells? Yes. How about cold? Can the cells die from cold? Yes, they can. Radiation can kill the cells. So this is physical damage. Mechanical is something like this. If I'm exposed to something like this, friction or something, and the cells die, this is mechanical. Chemical, it can be something from outside or inside, something from outside. You're exposed to chemicals, whatever the chemicals are. In the war, from the factories, you're working in a factory or something, and some chemicals are spilled on your skin or something, and it can be endogenous from some chemicals inside your body that if accumulated, it can cause death. I told you about infarction, and whether we see it here or not, you have to know it anyway. Infarction is death because of ischemia, low blood supply. Microorganisms are the small organisms, and these are bacteria, viruses, and funguses and other things, and we will talk about that later. Abnormal metabolites. What's the normal metabolites in the first place? The normal metabolites are the normal chemical products. Something like this. You're making fatty acid inside your body. This is the normal metabolite. You're making lactic acid. You're making something inside your body. This is a normal metabolite. If something that's generated that's not supposed to be produced in the body, this is called abnormal metabolite. It can be due to any reason. Genetic disease, you're forming something that's you're not supposed to form, basically. Nutritional deficits, you're not eating enough of something, like kwashiorkor, marasmus. Kwashiorkor is you're not eating enough proteins, so your body is shrinking, okay? Food deficiency. Iron deficiency anemia. You're having anemia because you're not eating enough, you're not getting enough iron in the food. Imbalance of fluids or electrolytes. Something like deficiency of low sodium level, for example. Hypernatremia, and so on. Necrosis, translation, death. And death can be due to different reasons. Necrosis means death. Remember this. Necrosis is the same as infarction? No. Both of them means death? Yes. But necrosis is any death. Ischemia is death only from shutting down the blood supply. We got the difference, right? It's everything is very specific. Don't say all of them are death. No, it's not. Necrosis is death for any reason, whatever the reason is. Okay? And necrosis means the cells died. And then how does it look like? That will give us some more details. So that the cells died, you call it necrosis. Does the cell become liquid shaped? Liquefaction. So what's liquefaction means? Liquid. The the cells become dead and looks like a liquid, liquefaction, which is basically the cells dead and the enzymes are released out of the cells, breaking down these group of cells and make it looks like a liquid, liquefaction. Coagulative is coagulation. So coagulation is like denaturation. It's basically like this. If you open a raw, just an egg, get an egg and open it, and you see the white of the egg is actually transparent, isn't it? And it's like a fluid, more. Expose it to heat for a few seconds. It will become white, colored, and solid, right? This is called denaturation, or coagulation. So coagulation, the proteins change the nature and the shape to coagulate, so it become more solid. Fat necrosis is, the name give it away. Fat necrosis. Necrosis means death. Death of the fat. Death of the fat, it means death of the fat cells. Instead of saying fat cell necrosis, they say fat necrosis. So the fat cells die and break down the fatty tissues. Caseous necrosis. Let me just give you one word that will translate it. Caseous is coming from cheese, and it's even close. Caseous means cheese. Caseous, cheese, caseous, cheese. Can you remember this way? Caseous. So this is where it dies and looks like cheese. So your word here is cheese. Okay? When you see a question, you're reading it's yellow, it's solid, oh, okay, oh, this is good. Did you see cheese? Yes. Caseous. Caseous means cheese. It's just a translation. Okay? By the way, there is usually, for the questions, there is a key, which the key is usually one or two words. If you see it, you got the question right. Like this. 2 lines. Did you see cheese? Death and cheese? Yes, you're done. Caseous necrosis. Okay? This is a coagulative necrosis of the kidney. This is liquefaction, necrosis of the brain. So these tissues died and it become liquid. Enzymes are released and it looks like a liquid. This is a fat necrosis, necrosis of the fat cells because of the fat become fatty acids. Infarction, I told you about that already, is one type of necrosis. So it doesn't mean necrosis. One type of necrosis that results from oxygen deprivation, no oxygen because of no blood supply. Okay? Blood supply. So does ischemia necessarily means infarction? No. Are we following? Ischemia is less blood carrying less oxygen. No blood, if it comes to the extent of no blood, shut off the blood, no oxygen. Because if less oxygen goes, you're still fine. You'll be struggling, but the cells didn't die. If it leads to death, now we call it infarction. How about gangrene? Same. Did you see gangrene before, or even pictures or something? Somebody having a gangrene in the lower limb, and the lower limb looks like brown or blackish or something. It is death, but infected with bacteria too, which is even worse. Because this has to be amputated. Anytime gangrene form, have to cut. Otherwise, the bacteria, this is a very bad bacteria that invade the dead tissues. These bacteria can spread. Instead of having, of course it's bad to amputate anything, but if the foot is gangrenous, just give it another week, it will go to the legs. Give it another week, it will go up to the thigh. So would you lose the foot or lose the whole limb, right? Gangrene, here it is, looks like this, and this is a dry gangrene, meaning it doesn't have like fluids or something, sometimes it's not dry. And that's it for this chapter.